Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with the educational videos about optimal health and the most innovative and holistic approach to your well-being. Today, let's take a look how you can manage and heal fibromyalgia with natural and effective therapeutic tools. Here in the US, over 6 million Americans suffer from fibromyalgia, and 90% of those fibromyalgia sufferers are women. Some health experts claim it's due to the decreased serotonin level within the woman's brain, but hey, whatever the cause, unfortunately, people suffering from fibromyalgia struggle with pain, fatigue, depression, and often common fibromyalgia symptoms prior to the diagnosis. And then on top of it, there's no immediate cure to relieve the often debilitating symptoms. So in this video, I will share with you some alternative solutions. Enjoy! To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you very much for your thumbs up as they help me building my channel. So what is fibromyalgia? Fibromyalgia is a long-term disorder characterized by widespread pain in the body, and it's accompanied by general fatigue. So that's the general overview. A person having fibromyalgia tends to have pain in specific areas of the body. We call them tender points that are extremely sensitive and painful. So even the slightest pressure on the tender points can cause pain. Now, this unexplained pain that goes on for more than 3 months is then diagnosed as fibromyalgia. But there is no clear mechanism which explains the cause of fibromyalgia. And the most common theory suggests that people who have fibromyalgia are in fact suffering from some problem with the pain reception. So such people develop an increased sensitivity towards pain. Their body's tendency to feel pain is higher as compared to others, or we can say they have a lower threshold level to pain. So the most common factors responsible for this increased sensitivity to pain are serotonin, or substance P, it's a peptide, and nerve growth factors. And in fibromyalgia, there is a low level of serotonin, which plays a vital role in inhibiting pain signals. But further, there is sort of a high level or increased level of substance P and nerve growth factors present, which then spread the pain signals within the body. So all of these factors together lead to this central sensitization, we call it, of the brain, causing hypersensitivity to pain and chronic pain. So the individual suffering with fibromyalgia will experience more pain to the same injury as compared to someone who doesn't have fibromyalgia. But did you know that 80% of serotonin is not necessarily produced in your brain, but in your guts? So your digestive system plays a vital role here in relieving the symptoms of fibromyalgia. The link between your second brain, which is your digestive system, your gut, and your brain is absolutely important here. So due to this central sensitization, the patient tends to develop hypersensitivity to touch or to the things which generally do not cause pain. That means the brain is in a constant state of reactivity, and I would also say inflammation. And that is why they also experience pains even when they're touched just gently. Because of this central sensitization, the pain tends to get worse if the individual is going through some psychological or physical stress. There can be anxiety, there can be depression, there can be injury, trauma, sleeplessness is a big deal here, and even, of course, some genetic factors. So let's take a look at the symptoms, and they can vary from person to person, but pain, of course, is the primary symptom in fibromyalgia. It's widespread within the body and is described as this constant deep, dull ache. There can be throbbing pain, sharp shooting pains, burning sensation. And you find the pain more in the muscles, the tendons, the ligaments around the joints. Exercise usually makes it worse. Others experience numbness and tingling sensations or stiffness upon lying in the same position for too long, or waking up in the morning and the joints are all stiff. A person with fibromyalgia has tender points, which are about 9 pairs of specific points in the body, which when pressed cause intense pain. As per the guidelines of the American College of Rheumatology guidelines, they say a person is said to have fibromyalgia when at least 11 of these 18 tender points are painful when a certain amount of pressure is applied to them. And these tender points are usually located around the back of the neck, the front of the neck, the hips, the elbows, the lower back, the upper back, the knees, the chest, as well as the shoulders. With it comes this fatigue, this tiredness. It's another complaint with people who suffer from fibromyalgia. Even after sleeping for long hours, people feel tired and drained out. They compare it to the feeling as if they had a flu. You know, a second stage user of a flu is when you have this muscle ache, you feel just, it's just everything feels like lead. Your eyes are all droopy and you just want to stay in bed. It's this kind of tiredness. And such tiredness can actually lead to chronic fatigue syndrome. And it stops people able from taking care of simple tasks during the day. It can be from shopping or even, washing your dishes. Everything just feels too much. Sleep issues is a big deal here as well. Difficulty falling asleep or maintaining sleep. Some may experience poor sleep quality in the form of light or easily disturbed sleep. It can be, of course, caused because you suffer from pain or restless leg syndromes. Sleep apnea could be part of that. So people feel usually unrefreshed in the morning when they wake up. Others suffer from fibrofog. We call it cognitive problems. Maybe difficulty paying attention, focusing, concentrating on mental tasks, remembering information even, learning new things, and following conversations become very difficult. And it's not sort of a lack of memory because, of age. This is really because you haven't slept, right? It's like you just focused non-stop on your pain and life just loses its quality. Others experienced a heightened sensitivity to their senses, right? Loud noises, temperature, or bright lights is even too much. And then there can be maybe other coexisting conditions which are aggravated. TMJ is one of them, temporomandibular joint dysfunction. Some women experience that their endometriosis is aggravated. They have painful periods, chronic fatigue syndromes, tension headache, and as I mentioned, digestive problems. And here, irritable bowel syndrome stands on the top of the list here, IBS. And with it all comes depression and anxiety. So it can be quite difficult to diagnose fibromyalgia, and there isn't really a definite laboratory test available too. While blood work and other tests, maybe rule out some other conditions, doctors usually rely on the feedback of the patient, him or herself. So what could be the causes? Well, genetics, family history, is there somebody in your family who had fibromyalgia, or you may be more susceptible to it? I would say women, absolutely. Age, maybe it comes usually between age 20 to 50. If you're allergic to chemicals, food allergies, right? I talked about the digestive system. If you experience chronic viral infections, hormonal imbalances, poor digestion, candida overgrowth, yeast infections, spinal misalignments, particularly in the cervical area, sleep disorders, neurotransmitter disorders or deficiencies, stress, absolutely, thyroid disorders, all plays part of it. And people who experience more autoimmune diseases like rheumatoid arthritis, lupus, ankylosing spondylitis, osteoarthritis, they may be prone more to fibromyalgia. And I want to come back to people with chronic viral infections. Epstein-Barr virus, which lots of us have Epstein-Barr virus because maybe they had glandular fever or mononucleosis in their teens, influenza virus, viruses that cause even hepatitis C and B, Lyme disease, where bacteria are involved. They all can be linked to fibromyalgia as well. Trauma. Physical and mental trauma absolutely can trigger fibromyalgia. Physical trauma, spinal injuries, right? As I said, particularly around the cervical area, watch out for that. And then, of course, emotional trauma, right? Divorce, the loss of a loved one or family member, all these are triggers to aggravate the fibromyalgia as well as PTSD. So if you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova, or New Medicine, is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. So book your appointment today. So let's move on to our second part of this video, food for thought, the metaphysical meaning of fibromyalgia. As with all of my other videos, I always invite you to go within and look, what could be the cause of me experiencing this chronic symptomatology of fibromyalgia? Look in your environment. Investigate your loved ones, the people you're engaging with, your work environment. What is causing you stress? Right? What is causing you this idea that you can't move on in life? So according to Chuck Martel, the symptoms of fibromyalgia is linked to perfectionism, anxiety, and making high demands on myself beyond my limits. So it has to do with fulfilling expectations of others, as well as pushing yourself to fulfill the expectations you put on yourself. Right? In all of that, you forget to play, to connect with your inner child, to enjoy nature, because you think you have to sort of meet the tasks. So it may originate from an event experienced at an early age, but was a source of great guilt. I feel unwanted, and I find it very difficult to assert myself. I don't feel that I'm up to the mark. I feel I've taken aback. I feel a lot of pressure from my entourage, but in fact, I'm the one pushing myself too hard. I feel anger because I have the impression that I'm not perceiving any love from the people around me. And I don't want to move forward. Remember, muscles and tendons and ligaments all have to do with movement, moving forward in your life. And because you pile yourself up with all these expectations, you stop yourself moving forward. I prefer to cut myself off from my emotions because I feel no gentleness in my life. Where does this constant pain come from? It often appears where I'm doing repetitive or monotonous gestures. It reminds me of my emotional suffering from indefinitely taking on responsibilities that I haven't readily chosen. I wanted to dutifully follow certain principles that were in opposition to my deeper needs. I am living a life for which I have no inclination. So what are the positive affirmations here? Well, I would say I accept to learn to take care of myself, to give myself the gentleness I so need. I allow the child who inhabits in me and grew up too fast to live its child life. I no longer have to be Superwoman or Superman. I only have to be me. I have the right to be happy and live joyfully. And I allow my creativity to express itself through play, the arts, sports, or any other activity that brings me greater well-being. And so I thrive, and a great inner peace settles in. So if you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths, qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I am coaching you to be well. So let's take a look at the natural treatment protocols. Treating fibromyalgia symptoms naturally requires a healthy diet, changes in lifestyle, and complementary treatment protocols. The first one is diet. Multiple clinical studies show that treating fibromyalgia symptoms requires a multi-pronged approach that includes changes in diet and nutrition. There was a collaborative study from researchers in Italy who found that fibromyalgia patients can benefit from specific dietary changes and nutritional supplementation. Now, this study found that the elimination of gluten, that all carbs, wheat products, everything what contains gluten, has the potential for improving symptoms of fibromyalgia. And the result is echoed in another study which is published in Arthritis Research and Therapy, where the researchers studied the effect of a 1-year gluten-free diet in patients with co-recurring sort of like IBS and fibromyalgia. As I said, digestive symptoms, irritable bowel syndrome are directly related to fibromyalgia. So in fact, one of these subgroups in the study experienced significant improvement in all symptoms and an improvement in quality in life scores. So that's the first step. Take away your gluten. Take it out. Right? Even do an elimination diet for 2 weeks and see if that makes a difference, if that is truly the trigger. I also would suggest caffeine, right? Because it affects your sleeplessness, insomnia, anxiety, muscle tremors, could even affect your depression, all of that. But just be aware that caffeine is not just in coffee, but in teas and energy drinks and sort of flavored sodas, and also in over-the-counter medication. Just watch out for it. Artificial sweeteners definitely have to go, as well as just a diet which produces more toxic burdens on the body, processed food, trans fats or partially hydrogenated oils. Just take them out. Bring in good oils like coconut oil, for example. You want to bring in foods which are rich in vitamin B12, C, D, folic acid, magnesium. So the goal is here to reduce the inflammatory factor and build the body's natural defenses. For some people, this may be a radical change in lifestyle, not just the diet. But want to bring in magnesium-rich food because it helps with the spasms within the body, the pain level in general. And you want to bring in lots of green leafy vegetables, pumpkin seeds, yogurt, kefir, almonds, avocados, right, which increase the magnesium levels. I would say 3 servings a day, really make sure that you nurture yourself. We want to bring in melatonin-rich foods. Melatonin helps you to fall asleep better. And you, of course, can take melatonin supplements as well, but sometimes they interact with certain medication, and that it deals with immunosuppressants, birth control pills, anticoagulants, and even diabetic prescriptions. So if you are taking these medications, of course, always consult your doctor, but maybe you have to look for melatonin-rich food. I would say sour cherries, cherry juice is rich in that, walnuts, mustard seed, rice, ginger, barley, asparagus, even tomatoes, fresh mint, bananas, red wine. But some people, find that if they eat tomatoes, the fibromyalgia gets worse, so be careful here. But there were studies that show that usually there's a deficiency in zinc, in magnesium, in folate with associated and also melatonin levels with fibromyalgia. So you want to bring in also foods which is high in tryptophan. And tryptophan is needed by the body to produce serotonin, and it's associated with a restful sleep. So nuts, grassy-fed dairy, fish, free-range chicken, sprouted grain in this case, sesame seeds, it's all good here. I'm bringing lots of omega-3 oils in the sense of with wild fish, with salmon and tuna. Coconut oil is really nice. It sort of, switches to with your unhealthy oils. Definitely 3 to 4 tablespoons per day in your diet. It reduces the joint pain, balance hormone, the hormones, improve the memory and overall brain function. Maybe bring in some fermented foods. We heard about kombucha or sauerkraut. It's important to stabilize your microbiome and your bowel flora within your gastrointestinal tract, particularly if you suffer from irritable bowel syndrome. And once you take care of your digestive system, your brain fog will disappear as well. You maybe want to bring in turmeric, which is one of my favorites here. It's also called curcumin in a supplement, and it's renowned with its antioxidant and anti-inflammatory effects. You want to mix it up with black pepper because it's a powerful combo. Fresh ginger, it's anti-inflammatory. If you want to add some supplements, so you can go to your health food store, and I would say acetyl L-carnitine 1500 milligrams daily, magnesium 500 milligrams daily, fish oil absolutely 1000 milligrams daily. You want to look for a high quality turmeric and black pepper combo 1000 milligrams daily. Vitamin D3, of course, 5000 units a day. And if you feel very stressed out, you want to bring in some herbs. We have Rhodiola and Ashwaghanda. Ashwaghanda is one of my favorites. And we talk about sort of 500 to 1000 milligrams a day. Now, Ashwaghanda or Rhodiola, we call them sort of adaptogen herbs. And it means like they balance you if you are too stressed out or when you are too low and you are under functioning. It balances your hormonal system quite well, and these herbs are great when you are exposed to high stress. You also want to think of 5-ATP, hydroxytryptophan, 50 milligrams 1 to 3 times a day. It sort of increases deep sleep, really. It works by supporting healthy serotonin levels in the brain. And but you can get that in your health food store. I would say regular lifestyle changes, moderate exercise. Of course, you're in pain, so you want to not do bungee jumping, but walking and swimming and gentle yoga, restorative yoga. If you can take a little bit Pilates to that, definitely acupuncture helps here. Massage, slight massage. Maybe manual lymph drainage therapy because it sort of drains the toxins from your body, which is really a slight massage. It's not deep. Want to maybe bring in some essential oils like lavender, put it in your warm bath. It helps to calm down the nervous system. So let's move on to our third part of this video, homeopathic remedies. The combination of lifestyle changes, diet changes, and indicated homeopathic remedies is really the way to go here, as it creates this ultimate treatment protocol. Fibromyalgia can be effectively treated with homeopathic remedies, and in this video, like all my other videos, I share with you only remedies you can purchase at your local health food store. The idea is to match your individual symptomatology, your unique symptoms of your fibromyalgia, with the description of the remedy in this video. For dosage plan and guidelines how to take these remedies, contact my practice Medica Nova at medicanova.net or email me at health@medicanova.net. I'm happy to help, or contact your local homeopath. So the top 3 remedies here for fibromyalgia are Rhus toxicodendron, or Rhus tox for short, Arnica montana, and Kali phosphoricum. And why use homeopathy for fibromyalgia? Well, the traditional treatment for fibromyalgia involves the use of non-steroidal anti-inflammatory drugs, painkillers, maybe anti-seizure drugs, antidepressants. It's not a great outlook. So as evidence, these methods are palliative. They just cover the pain, but they mask the symptoms instead of really dealing with the root cause of the problem here. So long-term use of these can also cause severe side effects. Homeopathic remedies offer a natural treatment for fibromyalgia and help alleviate the symptoms and treat the problem for long-term relief. So we're not looking for a short, quick fix. We're looking for deep and lasting healing here. There are also no side effects, as these remedies are made from natural substances. So the first remedy is called Rhus toxicodendron. I know it's a long name, for short Rhus tox. And it's really the top listed remedy from fibromyalgia. And it covers this widespread pain in the body. The pain is present in the muscle, the tendons, the ligaments. It can be of a tearing nature, shooting, stitching even. And it definitely gets worse on exercise, on motion, and during the night. You maybe experience restless leg syndrome even. The sleep gets therefore disturbed. But the keynote here is stiffness. So when you wake up in the morning and your joints and muscles feel all stiff, think about Rhus tox. It's fantastic remedy when you have that keynote of this widespread pain in the body accompanied with stiffness. The back pain is very prominent here, and it gets better with continued motion. So once you get up and you get going, things are looking up more. But there is also this indicated numbness and tingling present. So look out for that. So what are the key indications? Widespread pain in the body, stiffness with body ache, and the symptoms get worse on exertion. If your keynote symptoms is just pain or bruising, if you feel like as if you were beaten, that's the remedy Arnica montana. And as I said, the keynote here is more soreness, bruise pains in the body, very sensitive to touch. I mean, these are the people who, if they press a little tender points, they would scream, right? Very sensitive here. There may be fatigue, numbness, and tingling present in the limbs as well, or a history of injury, especially around the cervical area. So again, the keynotes here are sore, bruised parts and pains. There's this fatigue, of course, with the body aches, and there may be numbness and tingling in the limbs. We talked about the fatigue. Remember when I introduced you to the symptoms in general of fibromyalgia? The remedy Kali phosphoricum is great when you feel fatigue. It's this marked fatigue. And sleep issues in cases with fibromyalgia. There's this intense weakness, tiredness, and the whole system feels just drained out. The affected person gets easily fatigued and has body aches. Exertion again worsens the condition. Sleeplessness is a major thing here because of course you're in pain, right? And then you can't sleep. Maybe a prickling sensation in the hands and feet may be present here. So look out if you feel constantly tired. Fatigue, think about Kali phos as well. Intense fatigue, weakness, tiredness, sleeplessness with body aches, and they're all linked with fibromyalgia. You also can think about a combination of these 3 remedies. Let's say you definitely have the stiffness. So you want to take Rhus Tox 30 on a daily basis, but then also want to add the Califos, and here I would say in the biochemic homeopathic form, they're called cell salts or tissue salts. Califos has a lower potency, usually 6x, and it acts more as a tonic. So you can do 4 tablets morning and evening, plus the Rhus Tox 30 on a daily basis. That's a nice combo, right? Because you hit the stiffness, the widespread pain in the body, plus the sleeplessness. Now we have other remedies, right? But I just wanted to give you the 3 major ones. But I want to mention Bryonia alba, which is a wonderful remedy too. And here the pains are worse from motion, any motion, right? Rhus Tox makes it better from continued motion, but Bryonia alba is definitely in cases where any motion makes it worse. Lying down or absolute rest offers often relief. The types of pain, they can vary. They can be sharp, stitching, bursting, sore to tearing in nature. And again, the tender points often are found in the lower back and the knee. Stiffness can be there, but always remember, if it's worse on any motion, right, the Bryonia is the remedy. If you just feel like, all these pains get better with a warm bath or warm application, Magnesium phosphoricum is a great remedy here. And the character of the pain is mostly sharp and shooting. Light touch tends to worsen the pain. And there's a pain in the neck, the lower back, lower limbs, of course, here. And also the pains tend to radiate from point of their origin, right? They wander around in the body. There can be restlessness and weakness, of course, present. Cold makes it worse, right? In the winter time when the temperatures drop, you feel more the joint pains. But the keynote here, everything makes it better with a warm bath or warm application. If you only have fibromyalgia in the neck or the lower back, you think about Cimicifuga racemosa. It's a great remedy. Again, we have marked pains in the muscles of the neck and the lower back. A feeling of stiffness, contraction in the neck is also present, and you feel like no matter how much tiger balm and creams you slap on, it doesn't really go. So Cimicifuga is a great remedy for that. Again, we have this dull, aching, heavy pain in the lower back, improved by rest, and usually excessive muscular soreness is present here. Remember we talked about this second stage of the flu when you feel like, oh my God, I feel like lead and I just want to stay in bed and every muscle is aching. Think about the remedies. Gelsemium, sempervirens is a great remedy for this aching in the muscle, the tiredness, deep-seated pains, definitely worse in the back, the hips, the neck, under the scapula. There can be also headaches involved. And then also I talked about anxiety and depression, right? So if you feel like by now it's a mental, emotional issue and or you lost a loved one, right? Or you just went through a divorce and you had psychological triggers which aggravate your fibromyalgia. Think about the remedy Ignatia Mara. Fantastic remedy, particularly if you link the fibromyalgia more with depression. Or the depression, was the actual first trigger which led into the fibromyalgia. History of emotional shocks, as I said, like loss of a loved one, divorce, major grief or disappointment may be present in people needing this remedy. There's a lot of sadness. Weeping goes on, desire to be alone, and just when you're sad, right? That would be a great remedy, because a painkiller doesn't take away the sadness, right? But a vibrational medicine, a vibrational remedy which deals with your mental emotional remedy without causing side effects. Isn't that a magic situation? Isn't that what we all want, right? And it can be done. There are other remedies. Rhodiola is more for fibromyalgia with restlessness. Arsenicum album we have for marked fatigue again. coffee accruta if you have sleep problems, causticum if it's more related to the widespread pains, and so on. So we have a lot of remedies to offer for these specific individual cases. But for your understanding, focus on Rhus tox, Arnica, Kali phosphoricum, and see if that goes. I hope this video gave you some insights how to manage and heal your fibromyalgia with natural and effective therapeutic tools. For further questions about the treatment protocol, contact my practice Medica Nova at medicanova.net or email me at health@medicanova.net. If you're interested in learning more about homeopathy, how to apply it with your friends and family and yourself, have a look at my website medicanova.net at the Online Academy, where you will find certified university standard home study online courses in homeopathy, health and wellness coaching, integrated mental health, quantum healing, and so much more. And thank you for subscribing to my channel. Share and like it with your friends and family. And thanks for your thumbs up. Till next time, much love. Take care.